Hey everyone, you're tuned into InfoQuench with Jeff.
And Amy. Join us as we talk about anything.
And everything.
All the stuff that makes life interesting.
So let's get to it. Hey everybody, and welcome to InfoQuench. I'm your host Jeff.
I'm Amy.
And today we are continuing our discussion on COVID-19.
That's right. So this is Pandemic Volume 2. We mentioned that we would likely do a series on this because this is a long-term thing, or at least for our near future. So we're recording this particular episode on Thursday, March 19th. At this point in time, there are only 11 cases in our province, which is New Brunswick in Canada, and good news is there weren't any new cases in the last 24 hours, but we know that is
going to change.
That is going to change, and of course, the number of tests being conducted obviously has a direct impact on the number of cases that are detected. But we'll take that good news when we can get it. But a major event happened in terms of our province today, in that a state of emergency was declared.
Yes, a state of emergency where they closed all non-essential buildings, really. Like, the only ones that are really open are grocery stores and car repair shops, and what other ones?
Oh, quite a few. So there are grocery stores, pharmacies, car repair. There's some construction supply stores, I believe. Anyways, we won't go through the whole list, but they've basically moved to closing non-essential services. And a lot of people, I think, start to get into a bit of a panic mode when they hear state of emergency, but it really is a good thing. It's a positive step for the government to take. And I know I've personally been really proud of how proactive our provincial government has been, and also at the federal level as well. But
I think we're lucky, though, because we are able to look back at some of the mistakes that previous places have made trying to contain this virus, and we can look ahead and see the steps that need to be taken and take them. Absolutely.
It's we're sort of learning from others because we're sort of at the a little bit further along in the game in terms of the overall pandemic. But I say further along in the game, we weren't hit as early as some countries were. So we've watched what they've gone through, and our politicians are being proactive. And criticism is often received when the action is taken, and then within days, I think the vast majority of the public realized that was the right step to take. When the schools were closed, there was some pushback on that. And then when daycares were closed, there was more pushback on that. But I think even now, less than a week, or probably 2 weeks ago, that those decisions were made, people have a very different view of what impact that type of intervention can have, what positive impact. So when I hear state of emergency, I think this is something that has empowered our government to enforce what they were before as recommendations for social distancing and for businesses. Now they can actually make them a requirement, and it allows them to protect the residents. They can do things like not allowing landlords to evict tenants for a set period of time, knowing that people are under financial stress. So there's a lot of positive things. So I just would like to say for our listeners, when you hear state of emergency, don't hear panic in that. Hear that there's power and tools and resources being made available by our provincial government to our provincial government by enacting that. And
the more preemptive that they the decisions that they made, the more preemptive they were, the better it is in the long run, because they can get ahead of it.
It's definitely the short-term pain, long-term gain type of scenario. So we're going to spend this episode really just talking all about everything that we're going through.
Yeah.
And some more tips, around infection control and that.
And stress, dealing with your stress, I think, as well. I don't know if loyal listeners of the podcast have noticed, but I'm not really super stressed out guy often. But this pandemic and just the whole different way of living our lives has really affected me. I feel like I'm much more stressed out than probably I ever have been in my whole life, because I'm worried about the family. You know what I mean? And I worry about the future and stuff. But all the steps are being taken to, make the right choices. And so you just got to trust in that, you know?
That's one of the a good point. One of the key messages that our provincial medical health officer gave in one of her recent briefings was around mental health, and that mental health is as important as physical health, and that we need to take care of that and be aware of it. People who typically may have been quite laid back, may not. And the other thing is not to be, I guess, unaware of what our kids are picking up just from being around us, even when we think we're sheltering them from television shows, the news and that sort of thing.
Right.
They're
listen,
picking up on our
pick it up.
discussion. They're picking up on our own stress, and we can't protect them 100%, but sometimes it can come up as things that are a little bit,
like it did for our kid today. Like he was kind of complaining that he wasn't feeling so well, but we took his temperature and he ended up feeling fine, but we feel that it was his way of showing that he was perhaps a little stressed about everything.
I think he's feeling it, and stress is contagious in and of itself.
Of course. And we have been conscientious of that, and there are ways to speak to your child about this virus for them to understand as well, because I really don't feel like children should be necessarily left in the dark about what's going on. They should know the severity, they should know the seriousness of it, but they shouldn't be, stressed out. They don't need to know every single detail.
Well, that's right. I think everybody, including ourselves, we as adults, we need a mental break every once in a while from the news, from the media. We need to keep ourselves informed, but we don't need to keep ourselves informed every 5 minutes.
That's right.
Doing a few check-ins at certain points during the day to maybe checking on your provincial or state news briefing, and then your national news briefing to be aware. It's we have to be conscious of that.
Yeah, I think one of the sources of my stress too is that I'm an essential worker. Like I can't just stay home. I can't do my work from home. So it's it's always stressful when you have to leave your home to go someplace else where you don't really know how careful people are, trying to combat this pandemic. So
that's right. There are a lot of people who don't have the option of staying home, and thank goodness for the people who are doing that important work too.
Yeah, the grocery store,
people stocking the shelves, the pharmacists filling our prescriptions.
It's incredible.
Of course, medical staff and fire and police, all of our protective services, all of those, the things that we sometimes take for granted. They're sort of keeping our lives running in the background, and they're putting themselves out there, and they're all going back to their families. It's so
creative too, the way small businesses and larger businesses are adapting to this pandemic to still give their business to their customers. Like a lot of businesses are delivering and whatnot, and takeout for restaurants is still allowed for now. But it's really interesting the creative ways in which businesses can have been adapting to this.
Yeah, people have been really creative, and I think it's important. I think it's important to keep everybody's spirits up, and to give them some continued revenue stream. So keep an eye out for those opportunities to support your local businesses and entrepreneurs, and so you'll notice that we're releasing this episode. We normally have always done our episodes every Tuesday. That's sort of our schedule is Tuesday evenings we release an episode, but we decided to probably
we have a lot of time.
Double up. Yeah, frankly, we have more time on our hands and lots to talk about, with the pandemic going on. So we're hoping that you'll listen and maybe feel a little bit of a social connection with us. I know we're all sort of,
reach out and say hello.
Craving some.
If you have any questions for us about COVID-19, we're not professionals, of course.
Yeah,
but
if you have any questions for us, then direct them to a reputable site instead. So, some of the great sites, and I keep mentioning them, I think, in each episode where we talk about this. The World Health Organization is the gold standard at a global level, and they are compiling information from all of the different we've got the best brains on the planet working towards a solution for this. So there are teams, I heard that they've got a vaccine that's been developed and beginning testing in China, as well as in the U.S. And then I know that there's a Canadian team working as well on it, and probably many more. Those are just ones I've heard of in recent days. So, and they're working towards that solution for us, and it's incredible what can be accomplished when you have an entire world directed towards
Absolutely.
one problem and finding a solution. And we mentioned in the last episode just around the idea of, our kids having less social time, or not really having social time with their peers. And as adults, this is probably one of the times when we're appreciating social media more than ever. It's, just an incredible way to stay connected. I can't imagine what we'd be going through without the option of staying connected through social media. So our kids don't have that as readily available. And one of the things that we did is we started a page on Facebook. It's called Pandemic Parenting. So if you're interested in joining that, just search it out and ask to be invited, or ask to be added, and I'll add you in there.
Valuable resources on there.
We just started a couple of days ago, and there's well over 100 parents on there, and they're really just sharing all the great resources they're finding on how to keep themselves and their family busy, how to keep their kids busy.
Drawing, people teaching drawing methods and stuff for children, and all kinds of things. There's some on there for adults as well, for like watching, streaming movies, free movies and stuff.
Right, and we try to focus. Of course. Yes, we try to focus the content towards kids. But so the intent is really, I guess, if there's a lull in the day and the kids are bored, which there's bound to be quite a few at this point in time, is to have a one-stop shop to hop on and have a look and, just scroll through and find some content to keep them occupied. I'm personally working from home at the moment. I may be called in at some point to work in another capacity, but working at home, you need to keep your kids occupied because you can often be, involved on a conference call or something, and
they can't just be on their Nintendo Switch the whole time.
No, but a lot of the resources are screen based, and you know what, I think it's time, at any time, to cut yourself a little bit of slack, and you just do whatever you need to do to keep the peace and keep everybody happy and content. And there's some homeschooling resources, but I think a lot of the teachers are just saying, as long as you just keep reading and doing some basics. I mean, it's this will pass, and they're not going to fall behind because of it. It's one of the more sort of entertaining and fun things that we've done with our little guy is we've set up screen time through FaceTime, like video conferencing or whatever it's called, and yes, through Facebook Messenger.
Through Facebook Messenger, that's it. And so they get to play with all these little different things that you can do with your face, and you open up your mouth and you're
sort of the filters that you'd use on Snapchat,
and that was an incredibly. I could feel like the fun release for both parties. Like my mother and Huxley had like a nice video conferencing, and they were laughing, going through all these different things, and it was it's highly recommended if you haven't done something like that already, to keep in contact with family and friends and stuff like that is just the absolute best.
Well, you can even do a group chat. You can add multiple people. So if you wanted to have a Friday night cocktail or something with friends, or a Sunday morning coffee with friends, then you can get together, online and just pretty much everybody who is on Facebook Messenger and has access to that, and it's just basically using your internet. So it's a good tool to have, and thank goodness we have it available to us. It does remind me of a point, though, that I wanted to talk about around infection control, because I keep hearing this repeated over and over again, and it's so frustrating that people are saying they're okay to be around. I know them. They're not sick. And, my mother's birthday was earlier this week, and we went out for a visit, and we visited them from well over 6 feet away. They, they came outside, and we all were outside in the yard, and we kept a very safe distance. And it was a great visit, and we all got fresh air.
We spelled happy birthday in the snow.
That's right.
as a card, as a virtual card.
As a virus-free card.
Virus-free card, that's it.
So, just because you know somebody, if you if you are, just recently contracting the virus, you may be asymptomatic. Just
Exactly.
because somebody doesn't look sick doesn't mean they aren't sick. It's such a strange comment to me because we wouldn't say,
It really is.
oh, that person has the flu, but I know them. I'm not going to catch it from them.
I know.
But for some reason, people feel as though if they know somebody, then there's no way they could have this virus. And that's simply not the case. It's highly contagious. And it's not, it shouldn't put people off that you need to keep a distance. I think it's becoming well known, and I think it's probably one of the greatest acts of love you can do for your relatives, your friends, and for your community as a whole to keep that distance.
Yeah, it's really nice. We go to this local park called Rockwood Park here close to our home, and we just stay on a trail where there's really not that many people, but every once in a while a couple people will walk by, and there's still that really nice civility, that Canadian civility where people walk by and they're like, hey, how you doing? And then some of them even say, stay safe, and which is really, really heartening, which is great.
It is. And, just some tips around if you are going out to the parks and trails. It's an interesting time because this virus really has driven a lot of people out into nature. We're cooped up inside, so then we go out to nature, but we have to find places that aren't really
super populated.
Exactly. We actually drove to one location this evening and
it was packed.
It was packed, so we went around and found another place. Now it was just an open trail system, but the trails were quite narrow. So we knew we would be passing a lot of people. So we went to a place we actually went to our Rockwood Park, and there's a section where there's a wider road, or sort of the width that you could drive a vehicle through. So it allows for a lot of distance. You've got people walking on one side in one direction and the other, and because it's a lesser known trail or a less popular trail.
It's so important to get that exercise as well.
So make the time to get outside and get fresh air, but do it safely, because even though you're outside, you still need to keep the distance.
Because we really don't know, what this pandemic has for us in the future, and we may not be able to go for walks like that in the future sometimes. So get it in now. Not trying to be alarmist or anything, but we don't know.
Right. No, we don't know what the future holds. And
that's right.
Another thing that Jeff and I have done is we've actually removed all of our jewelry. So our, our wedding rings and things, we've taken them all off, put them in a safe place, and, just keeping the nails trimmed up short, not wearing nail polish. You can kind of get a good view of the nails. And it's just, those are all sort of things that they often do in a healthcare setting anyway. It's just good. It makes the hand washing so much easier. That's what I was just going to say.
It's incredible.
World's easier.
I almost lost my ring a couple of times washing my hands in the early days. So, I'm glad that we decided to do that because I wouldn't want to lose it.
Right. So it's kind of an odd thing at first, but again, it's just in the name of infection control. It makes hand washing a whole lot easier. And I don't know if I mentioned that there's sometimes an overdose of news and information on this type of stuff, and I'm probably as guilty as anyone because I tend to eat it up.
You watch the major ones, though.
I do watch the major ones, and I also try to look at some of the research that's coming out around the virus, and it does keep changing. It's they're discovering new things by the day, by the hour on it, and one of the major things that came out this week was around how long it lives on surfaces.
Yes.
So I had read a study, I think it was Harvard, who had put it out earlier this week. Anyways, it came out of the U.S., and it talked about the virus living on cardboard for up to 24 hours, and that's since been repeated in a few different news cycles. So that must be fairly well, I guess, accepted at this point that's a possibility. So what that... we'd already been doing this, but just kind of in case you weren't already thinking this, we have a mail slot, and when the mail comes through our mail slot, I put on gloves and pick it up and put it straight into the garbage.
Except for this, the important mail.
I'll open up if I have something. I'll open it up, set it on the floor, and take off my glove, take a picture, whatever it is. So I have the image on my phone, and then just throw out anything that has come in through the mail. There's not very much now that we get. Mail. It all comes electronically anyway. But just be conscious of parcels and things that you're getting that you may. Not everything can you throw out.
Yeah, that calls into question. I'm sorry to cut you off. That calls into question, getting takeout and stuff. Like how safe is that? Like, I know that people are probably taking precautions, but we don't know, right? For sure, if they're wearing gloves when they get their pizza box or whatever it is, and then like it shows it up at our home. Well, that could live for 24 hours if that person had the virus, and I'm just saying, but they haven't stopped that because people need to eat, right? I mean, I don't know.
Yeah, no, I mean,
something that came into
definitely.
my head.
I know a lot of local businesses are doing takeout and that sort of thing. I think we'll probably learn more as we go along, but maybe just, be thinking of those types of situations and try to minimize the potential for the virus. If you do get a parcel or something delivered, maybe it's setting it aside for that 24-hour time period if you've ordered something through Amazon, because it's not just contamination at the point of packaging, but also you've got whoever's delivering it is handling multiple parcels. Depending on which company is delivering it. There's so many different delivery companies. Anyways, just something to think about around the cardboard piece. It also calls into question when you're bringing home groceries, how should you deal with items that you're bringing into your home and making sure that they're, that they don't have the virus on them. So we've actually we had stocked up on groceries and hadn't had to get anything perishable really recently, but the non-perishables, I've actually set them aside in the house and I'm going to leave them. They're saying now, I've read anywhere from 2 to 3 days to 3 to 4 days for the virus to live on plastics and stainless steel. Again, from that same batch of studies, which could be disproven down the road. By the time you listen to this podcast, it could be
things are changing
right?
so rapidly.
But just in thinking of that and thinking that it could be on plastic, so things like bread bags, and then when you're at the grocery store, paying attention. If you're getting a few items, self-checkout may be the way to go, depending on what the practices are of the store. If the cashier isn't disinfecting their hands or their gloves in between each checkout, then essentially they're checking out the person's items before you. Then that person has touched all of those items. The cashier has then touched them, and then they're touching all of the items they're putting in your cart. So they're essentially passing along what they've touched.
There's a lot
since they've last
opportunity for
and
spread.
The gloves protect themselves, but it doesn't protect transmission between one item to another, right? So these are just, sort of things to think about when you're out and about getting groceries. At this point, we're not supposed to be going out for anything that's not essential, but even at the gas pumps, I mean, you're gripping a handle. If you have gloves, that's great. I know not everybody has gloves. They're kind of in short demand now, but if you don't have gloves, even making sure that you use your sleeve. You can use a piece of paper towel. Sometimes they have those wipes at the pumps. And
actually, maybe not your sleeve, right?
If you have hand sanitizer, no, don't use your sleeve. Definitely don't use your sleeve, because then what you'll do is contaminate your sleeve. And then a lot of people, what they're doing to avoid touching their face is they're basically wiping their sleeve on their face. Yeah. So keeping your sleeves clean is also an important piece of the infection control. Right?
Except for the part where you sneeze into and you can't bother.
There's that piece, right? But that's your own sneeze. That's to protect.
Yeah,
that's to protect other people when you do that, right?
Yeah.
So, I know that a lot of this does seem excessive, but we're in an unprecedented, excessive times.
It lives a long time on metal as well. Copper, especially.
Stainless steel, copper. It's
4 days on copper, was it, or something like that?
I've heard 2 to 3, and I've heard 3 to 4.
Okay.
And then I've also heard the big discussion that came out this week was that it lasts up to 3 hours as an aerosol in the air. Now, apparently, the study was done in a very, unique environment where it was actually an aerosol type environment. Not what you would normally find in terms of, humidity, temperatures, all those things would affect it. But in that unique aerosol environment, they were able to, they found that it could be suspended in air as long as 3 hours. So I think that put people in a bit of a, more worried, but I think it was a very specific test. So we'll probably find out more about that in the days to come on how that is.
I know we're jumping around a little bit, but I'm just going to say that it's nice too, if you do have a loved one or whatever that needs to leave the house to go to work and come back, it's very important to have a routine set for that person when they arrive back at the home. They're not to touch too many things before they get to the bathroom to wash their hands. I know you're really good when I get home from work. You're there to make sure all these steps are taken care of and that they're done properly so that there's no chance of, in sharing an infection if you have it,
So some of the things that you can think about is if you have doors that you're opening and closing often in your home and they don't need to be closed, you can leave them open. That just stops people from grabbing the same doorknob over and over again. And
That's right.
Doorknobs are a key touch point. They talk about disinfecting the surfaces, on a daily basis that are your high touch points or high touch surfaces within your home. So keeping some doors open that, if there's a pantry door that you're in and out all the time, you might want to keep that
Right.
open.
Light switches.
When you're out in public and you are having to go out for essential items at the grocery store and if you don't have gloves on, make sure that you're grabbing the handle maybe in a lesser used place. Grab at the top, grab really high or really low.
Yeah.
I'm a bit taller, so I tend to grab high up on a door to open it. Just try to avoid the high touch zones, particularly in public, but also in your own home. It helps. I mentioned the World Health Organization's website has great resources. They're developing resources and updating them continuously as new research becomes available. One of the ones, and they do have an overload of information, not an overload, but they have information for people who are providing care in a hospital setting, what politicians or community leaders should be doing. But there is a handout that you can find quite easily just around how to care for somebody within the home with coronavirus that causes the disease COVID-19. And it gives really great information that will kind of give you an idea of what the latest findings are on how to treat the virus. When you read about how you have to clean surfaces, what types of solutions to use. They have a list of all of the approved solutions for killing the virus.
That's super helpful.
They do things like the linens of somebody who's infected should be washed at a higher temperature. So things you may not necessarily think of, it might be worth reading through that. It's not a copiously long document. It's a couple of maybe 2 or 3 pages of PDF.
Short and concise like it should be,
but
so that people can absorb the information.
Right. I think it was just recently updated, even just 2 days ago, with the most recent information. The other thing I would like to give as a tip is just always try to be thinking a few steps ahead. And I don't mean by panic buying, because that's not necessary. Our supply chains are continuing in that.
Absolutely.
Get what you need, but if you can think a little bit ahead, you can stock up on a couple of items that you might need. So for instance, when we read about the symptoms of this when it first came out and realized that we needed a good thermometer, we went out and got one. And it
was the last one as well.
There were only 3 left at the store when I had gone, and that was a couple of weeks ago. This week there was a mention that, and at that time I had stocked up also on 2 different types of medication to treat fever, which was a symptom. So Advil and Tylenol,
which has since been debunked as Advil, right? The ibuprofen. Is that
debunked?
Right? Well, no, you're not supposed to use it, apparently.
Oh, yes. So this week it has come out that they've
Right.
taken the stance that ibuprofen isn't something that's recommended to treat it. So when you hear something like that, think straight away that maybe I should, if you do need it, get the Tylenol, because then
Absolutely.
the masses, when that type of announcement is made, they run out and they go and get, whatever it might be. So make sure you have your 1 or 2 bottles, nothing excessive to deplete supplies. They made an announcement that one of the nearby provinces, the liquor stores were going to be closing. So, that might be the time to do your final run if that's one of your essentials.
Yeah.
I'm not promoting going out for things that aren't necessary, but if you, if you can go out early before something becomes incredibly congested, that's the time to do it. So kind of, listen up for those recent findings and announcements and try to think a couple steps ahead. And, that'll help you cope a little bit better, I think.
Yeah. And I would like to just add that this is a wonderful opportunity to spend time with your family and whoever you are cooped up with during this pandemic. It's a great time to spend that quality time with those people and cherish it. because life is short, you know.
So I joked with somebody recently. I said in 9 months there's either going to be a lot of babies or a lot of divorces.
Yeah, exactly.
So hopefully you're on the side of love and not and not
I think we'll push through on.
pulling a Shining and being all cooped up together.
So as Amy said before, we're going to step up our frequency with these podcasts because of the times we live in. So
all right. I still had so much to talk about even in this episode, so definitely looking forward to the next one.
Yep.
And stay safe, everybody. Social
Stay
distancing.
safe.
It's not a recommendation anymore. It's a requirement.
that's right.
Keep yourself safe. Keep your family safe. Keep your community safe.
Okay, we love you.
Thanks
Bye-bye.
for listening.
Thanks for listening.
And remember, you can catch up on past episodes at infoquench.com.
Or just about anywhere else you get your podcasts.
Be sure to follow us on Twitter, Facebook, and Instagram.
And help spread the word about InfoQuench.
Till next time.